Welcome to ACT Webinars for Health Professionals. Delighted to bring you a timely presentation on how to stay heart healthy in 2024. So now I'll introduce you to our subject matter expert and leading conversationalist for today, Dr. Brad Serwer. Dr. Serwer is the Chief Medical Officer for VitalSolution and a practicing interventional cardiologist. He joined VitalSolution in 2021 after retiring from the U.S. Navy and has been in clinical practice at Wayne Memorial Hospital in Honesdale, Pennsylvania. Dr. Serwer is passionate about improving health care in rural America and combating healthcare disparities in underserved regions of our country. He lives in Bethesda, Maryland, with his wife, Shelley, and their 7 children and 2 dogs. Welcome, Dr. Serwer.
Rob and Dr. Geiger, thank you so much. And I really appreciate the opportunity to get to speak with you and everyone that's took time to log in this afternoon. The ACT program has really been an outstanding asset and resource for all of those that not only work with Ingenovis, but have ties with Ingenovis. And thank you for everything that you've done to put these webcasts, these conversations together, plus all the other tools and resources. They're just fantastic. It's important that that we share that we all have different jobs within Ingenovis. We all have different roles, but we all work as a team. And if we can't be there for ourselves, we can't take care of our own health, and we can't be there for each other, and more importantly for the communities and patients that we serve. So I can't thank you enough for everything.
No, thank you for joining. Absolutely. And, the floor is yours. We're interested in everything you have to share today.
Well, I thank you. I'm going to share my screen. So as you all know, February is Heart Health Month, and a little bit more specifically, Women's Health Month, Women's Heart Month. And so I really appreciate the opportunity to kind of get to sit down and speak with you all about some very important, timely, key initiatives and ways to help improve upon your own health and things to look out for, not only for yourselves, but your family members and for loved ones around you. Here we go. Heart disease is still the leading cause of death in the United States. In 2020, we saw nearly 700,000 deaths from heart-related conditions, accounting for up to 20% of all mortality in the U.S. When we talk about heart disease, I think it's important to realize that we're not just talking about heart attacks. Yes, heart attacks are huge and are what everyone gets concerned about. But when we talk about heart health, it's important to realize that there are multiple things that we look for and that we treat within the specialty of cardiology. Coronary artery disease is my particular area. When someone comes in with a heart attack, they have a blood vessel in their heart that's shut down, causing pain, and ultimately, if not treated, can lead to death. I'm an interventional cardiologist, which means that I actually have further training in balloons and stents, so I can go in with my team. We can open up those blood vessels, and that's what our specific area within Ingenovis, VitalSolution, deals with, at least the cardiology aspect. But we also have other issues that we treat, such as abnormal heart rhythms, palpitations, or arrhythmias, as they're typically referred to as abnormal heart rhythm disturbances. So some people have heard of the heart rhythm conditions like atrial fibrillation or SVTs. These are all abnormal heart rhythms that can lead to a lot of bad issues if they're left untreated. Atrial fibrillation is incredibly common in both men and women. As we get older, the likelihood of that developing goes up significantly. AFib is a problem for 2 reasons. One, it can lead to untimely heart attack, stroke, and death, and most importantly. And second of all, it really can lead to a significant impact in your way of life. When your heart is irregular and racing, heart rates may be 150, 160 beats a minute. If you're out exercising and you have a heart rate of 150 for a short period of time, that's fine. However, if you're not exercising and it's that way for a long period of time, your heart can tire out. And so it's important to be aware of these sorts of conditions. More importantly, something's not right, to seek care to get it assessed and treated. Heart valve issues. So with time, some people are born with abnormal heart valves, but with time, we tend to have some calcium that can deposit on these valves. The valves can degenerate and stop working appropriately. And really, we've had ways to treat heart valve conditions for many years, but they relied on surgery. Over the past 15 to 20 years, we've seen some major advances in what we call percutaneous or transcatheter approaches. We can actually go in through the femoral artery in the leg. We can go up, we can replace the aortic valve in the heart without ever having to need bypass or open heart surgery. It really is revolutionary and groundbreaking. And so heart valve conditions are something that we treat. But ultimately, if all of these conditions fail, if people do have coronary artery disease or abnormal heart rhythms or have valvular heart disease, or are unfortunate and have some inherited conditions, they can lead with the final category, that's congestive heart failure. Congestive heart failure sounds atrocious, heart's failing, but typically what it means is the heart's not able to pump forward the amount of blood needed for the vital organs to work. And sometimes the pressure in the lungs can get backed up and people can get fluid developing or building up in their lungs. People can get fluid build up in their legs or in their abdomen that can lead to issues down the road. So, we treat all of these issues in particular. Within cardiology, I like to say you've got the general cardiologists that do a little bit of everything. Then you've got your plumbers and your electricians. Plumbers, that's me. I'm a plumber. You have a blocked artery, we open it up, we put a stent in and fix it. Then you have your electricians. Those are the electrophysiologists that can go in and potentially do ablations or eradicate some of these abnormal heart rhythms. And then you've got the general cardiologists that do a little bit of everything. So that's kind of a brief overview, but more importantly, from here on out, I really want to talk about how to avoid any of these issues, how to avoid having to see someone like myself or one of my colleagues. Because a lot of these issues, while they're not completely avoidable, can be delayed or even prevented in some instances. So when we talk about everyone wants a top 10 list, well, this is my top 10 list, heart healthy tips. I really break them down into 3 categories. When we talk about how to adjust your lifestyle, we talk about diet, we talk about lifestyle, and then the third group that I think is one of the most important is knowledge, and we'll delve into these individually. From a diet perspective, I wish it was easy. This is one of the areas where people just keep hitting walls, and it seems a little ominous. People always want that fad diet. What can I do to drop 15 pounds or look good at the beach? Well, that's great. Not saying, not trying to diminish that, but what's more important is how do I live healthy and well for 9,500 years or even longer? And a lot of these diets eh, are falling out of fashion. American Heart, instead of talking about diet or using the term diet, they talk about lifestyle changes. So, what do you need to do? Well, the first thing is to assess what you eat. Make stepwise changes so that over time, you're not just following a diet that's restrictive that you can't follow, that you're going to result back to your normal eating habits, but make significant changes and make them gradually so that your body kind of adjusts and then becomes a way of life. Clearly, I want you to avoid the things that are just overtly bad. Processed foods, highly fast foods, fried foods, foods that are high in sodium, high in saturated fat. We all know those are bad. No one thinks that they could eat healthy going in and having a Happy Meal at McDonald's. But nonetheless, it definitely bears repeating. We do know that there are really a lot of health benefits to increasing your dietary fiber. We recommend eating whole grains. Fresh fruits and vegetables are fantastic. They don't have a lot of preservatives. They don't have added sodium. They are nature's uh, fountain of youth, so to speak. And when we look at those that really adhere to a very strict vegan-based diet, plant-based diet, we have seen really very exciting research and data that shows that they can potentially stall and reverse some underlying coronary artery disease. Now, in rural America where I work, when I tell someone that they need to stop eating steak every other day and their fried chicken and they need to eat a vegan diet, the first question is, what's a vegan diet? Like, okay, that's fine. I get it. Let's talk about some things and start making some changes so that you can phase these in over time. A lot of times when people are very used to having high sodium diets, when you cut out salt entirely immediately, nothing tastes good because your taste buds essentially have to kind of regulate. So I tell people to taper down, to start working towards that ultimate goal of very, very lean meats, Minimize red meat as best as possible. Fish, especially those that are high in omega fatty acids. Salmon is fantastic. There's some good data behind that. If you're having chicken, make sure it doesn't have the skin, etc. But really focus on whole foods. Stay hydrated. Uh, so often I talk to patients and they tell me that they get dizzy in the mornings and they don't want to take their blood pressure medications. They check their pressure, and their pressure in the afternoon when they check it is through the roof because they didn't take their medications in the morning. And they talk about, okay, that's great. Let's talk about your diet. Let's talk about what you're eating and, more importantly, what you're drinking. And I'm guilty of this. You wake up, people don't drink water. What do they have first thing? Cup of coffee, 2 cups, 3, sometimes 4 cups of coffee. They might have a soda at lunch, and then they might not have anything for the rest of the day. And at dinner, they might have, a beer, glass of wine. And while I do enjoy those things, I can tell you that caffeinated beverages, caffeine is actually a mild diuretic, so it can actually cause you to diurese and dump some of that fluid that you take in. Alcohol has potentially some benefits. We'll touch base on it in a little bit, but excess alcohol can be very harmful, as can beverages that have a lot of caffeine as a stimulant. A little bit of benefit to lower dose, not a lot of benefit in high dose. Uh, be aware of that. And ultimately, making sure that, ideally you have 64 ounces of non-caffeinated, non-alcoholic fluids a day. So shifting gears out of diet, lifestyle. Well, with lifestyle, this is not just exercise. This is stress reduction, this is exercise, and this is avoiding things that we know absolutely without a doubt are bad for you. How much exercise is enough? Well, American Heart Association states that the goal is 150 minutes of aerobic exercise per week. Breaking that down to 30 minutes 5 times per week, that's a goal. And while some people are exceeding that, if you're not used to exercising at all, that might not be something that I would want you to jump right into. I would want you to build up to that. People want to know, what kind of exercise do they need to do? And that's not always an easy decision. A lot of our patients are elderly. A lot of our patients have weight issues. They may have joint issues. And so finding an exercise program that, one, is not going to cause you harm, two, something that you can enjoy. The more you enjoy it, the more you'll be able to continue that long term. Once again, we're not training for a specific event. We're not talking about getting you pumped up and ready to run the Boston Marathon in April. We're talking about making sure that you hit that that finish line, at age 85, 90, 100, whatever it may be, in the best shape possible. So exercise, alternate strength and aerobic activities are highly recommended. There's a lot of benefit to weight and strengthening exercises, as well as aerobic exercises. Stress reduction. And this is one of the very simple to write, very simple to say, consider doing yoga or meditation or deep breathing. The big phrase nowadays is practice mindfulness. Put down your phone and not focus on anything in particular, and just let your mind rest. And I hate to say, but when I look at my kids, they don't do that. We're on our phones 24/7 when we're working, we're talking with people, we're solving problems, we're trying to avoid problems, we're trying to put out fires, we're on our phones, we're looking constantly at what our next meeting is. So take time, put your phones down, focus on breathing, and just let your mind reset, kind of come back down to that symbiotic, just kind of peacefulness. Once again, easy for me to say, not easy to do. And for many people, exercise is a form of stress reduction. If you can get into a nice habit, a nice structured program, then exercise is the world's best stress reducer. I know that when I could, go out and run for long distances, it was really just kind of this period of nirvana. Didn't have my phone. I didn't have to worry about what was going on with the kids' school or the sports games going on that weekend or what was going on at work. You can just focus on one thing, and that's just getting out to your destination, getting back safely. Other lifestyle issues, tobacco, and I put tobacco on there. Everyone knows smoking is bad. direct and secondhand smoke. And a lot of states have different regulations and stipulations about where you can and can't smoke. Used to be that everyone smoked everywhere, and it was a major issue. Now it's we're now trying to separate. If you do need to smoke, go outside. You're not around a lot of people. But nonetheless, if you can quit, quit. If you don't know how to quit, please talk to your primary care providers, talk to your friends, your family. There are a lot of tools out there to help you quit, because this is the one thing that, without a doubt, negates any medication that we can give to help prevent comorbidities in developing cardiovascular disease. And then I come back to alcohol. Excessive alcohol actually is a toxin, and alcohol at high levels can cause direct cardiac toxicity and can cause weakened heart muscles in many people. There have been some studies looking at particularly red wine. It's the antioxidants found in some of the ingredients in wine, resveratrol being one in particular, that actually has shown some benefit in lowering certain parts of the bad cholesterol that can form a lot of cholesterol plaques. So there is some benefit to one glass of red wine up to two. However, when people ask me, should they start drinking? Well, if you don't drink, I wouldn't recommend starting. But I do recommend trying to avoid a lot of the harder alcohols. There's very limited benefit in hard alcohol, and honestly, in beer. And while I do like a cold beer every once in a while, there's a lot of sodium in beer and a lot of empty calories. So the health benefits, like I said, with red wine are there, but that doesn't mean it translates to a lot of the other beverages. All right, moving on to knowledge. What does this mean? Well, I want you to know all of your health conditions. Know what your levels are. What's your blood pressure? What's your cholesterol? What are your blood sugar levels? Because knowledge is power. Once you know what those are, it's really easy to determine what we need to do to mitigate your risk. So often people don't want to take ownership of their own health conditions. And I'd say that it's more seen in men, but we see it in women too. When I ask a patient, what medications are you taking? The answer is, I don't know. Ask her, ask him. What medications do you take and when? So it's vitally important that you take ownership, because the people that actually sit in the driver's seat and dictate, have open, honest conversations with their healthcare team are the ones that tend to do the best. Talk to your family. Know what cardiac or really what any medical conditions that run in your family. Are you susceptible to different types of cancers? Are there endocrine issues that run in your family? Do we have issues with our thyroids? Do you have inherited forms of weakened heart muscles? We call those idiopathic or inherited cardiomyopathies. You can't choose your family. You can't pick your genes, but you can be aware of them. And more importantly, you can get screened. There are a lot of heart valve conditions that are genetically related. And so if I identify that a patient has some of these conditions, my first thing is you need to have your family member screened. If you have kids, they need to get screened for this, because knowledge is power. And if you can intervene and avoid a problem, that's far better than treating it once it hits an end state. Sit down and have regular scheduled visits with your medical providers. Stay on top of your medical conditions. So often I see people that say, well, I never felt bad, so there was no problem. No. I also hear, do you have high blood pressure? No. Oh, well, I see here on your medication list, you're on 4 medications for blood pressure. Well, I don't have it now. Okay. At one point you had heroic blood pressure, and that's why you're on 4 medications. So you have high blood pressure. It may be well treated, but know what your conditions are. Know what medications you're taking. So often I say, I don't know, I take that little pink pill, or I take the blue pill, or I take the purple pill. What medications are they? Know your medications by name. And it's tricky. I get it. It's a foreign language a lot of times, because pills have a generic name, they have a trade name. Know one of them. You don't have to know both, but know one of them. Know the doses. If you've been on medication called Norvasc or amlodipine for blood pressure, have you been on the low dose? You've been on 2.5 milligrams? Have you been on 5? Have you been on 10? Were you on 10 and they reduced it to 5 because you were having issues with side effects? These are all things that are important. What we don't want to do is repeat the same things and make the same mistakes twice. We have now in most facilities very good electronic medical records. However, they're not perfect. And if you bounce from one facility to another, whether maybe you have moved or you co-locate, those medical systems may or may not talk to one another. So the more information you can have, the better. Learn the side effects to your medications and look out for them. We have some people that take that to the extreme, and they read that list and they come to you with every single thing on there. And why that might be a little bit annoying, it shows me, and I appreciate the fact that they're reading the information, they're taking control, and they're putting themselves as a priority and their own medical care as a priority. Know what's going on, know what to look out for, because what we need to do is find the best course, the best medications, and the best plan to make sure that you don't have issues down the road. Because like I said, especially when we're talking about coronary artery disease, if we can address the risk factors early, and if we can address diabetes, your cholesterol, your blood pressure, make sure that you're not doing all the bad things like smoking or excess alcohol, we can really avoid a lot of issues down the road. And then when we do need to add medications, those medications may save your life. Now, how do you tell someone who has no symptoms whatsoever that their cholesterol of, let's say their bad cholesterol, our goal is under 100 if you don't have heart disease. We try to get that down well under 70, close to 55 if you do. Let's say that their cholesterol is 200, their bad cholesterol, their LDL is 200, and you give them a pill and they're afraid it's going to give them muscle pains and they refuse to take it. I get it, but let's find another medication. Let's find something that would work, because if we don't treat that bad cholesterol, we do know that over time those cholesterol levels will build up in the arterial wall, form plaque that then has calcium deposit on it. Those plaques may rupture. When a plaque builds up inside the arterial wall and ruptures, it exposes a bunch of collagen to the bloodstream, and that collagen then acts as a sponge and it forms a blood clot immediately. And that blood clot then causes cessation of blood flow through the vessel, and that's what a heart attack is. So we can prevent those independently of just lowering a value in your cholesterol. So know your medications, know the reasons, realize that a medication may not make you feel better, but it's going to prevent issues down the road. And have those open, honest conversations with your docs. Everything we do in medicine is a balance between the risk and the benefit. And if the benefit of a medication or of a procedure or of a test is high and the risk is low, it's a no-brainer, then you do it. So with that, I kind of have this habit of rambling on and on and on and on. I do want to stop sharing my screen because I know that Dr. Geiger and other people may have a lot of questions. I am here for you all. So thank you.
Great. Okay. So I like this webinars. It's a little bit different. We allow the presentation at the beginning or the start of the webinar. Thank you so much for all of that information. It was really helpful. But now we get a chance to kind of put you on the spot and ask you some really just raw questions. You have a couple reactions. You may notice, Dr. Serwer, that there'll be a couple reactions throughout. So someone's really loving the presentation. The first question, if you're ready. You ready?
Fire away.
Okay. How important is regular checkups and screenings for maintaining heart health, and what should individuals expect during these appointments?
So thank you, Ben. That's a fantastic question. They are vitally important. Without knowing where you stand, without knowing what your comorbidities are for developing heart disease, we don't know how best to treat you. So it is important. Now, you may be fairly young and healthy, and you may not need to go every year. You may be young and have diabetes. And if that's the case, then you need much more regular follow-ups with your primary doc or with your endocrinologist. So they are vitally important. Two, what I tell everyone to do is to sit down and have the conversation to determine what is your risk for developing heart disease. And we have a lot of really cool tools to go out and to determine what is your individual. I can tell you that there are 700,000 deaths in 2020. What does that mean to you as an individual? And that's what we can do one-on-one with your healthcare providers. So the first thing is they're going to do simple blood work. They're going to check your cholesterol. They're going to check your blood pressure. They're going to find out what your blood sugar levels are to see if you're at an increased risk for having or developing diabetes. And then they're going to put all these numbers into a calculator. They're going to find out, do you smoke and all, and do you have family history of heart disease, or more specifically, do you have a family history of premature or early heart disease? And they're going to spit out a percentage, and using calculators like what we call the Framingham heart score, they're going to say, you've got a 10% chance of developing heart disease over the next 5 years. And what we need to do is intervene now. They're also going to screen you to see, do you already actively have symptoms? And, not all heart disease presents in the same fashion. And that's what's so important. And I should have mentioned this earlier in my presentation, and I failed to, but women don't present the same way that men do. And we know this. And so often when we look at healthcare disparities, we see that, when someone comes in and they've got crushing substernal chest pain and they give you what's called Levine sign, they take their fist and they put it right over their chest and they give you that gripping sign, and they're diaphoretic, they're sweating, and they're short of breath. An intern can make the diagnosis, and they say, oh, this guy looks like he's having a heart attack. They do an EKG, they see that he is having a heart attack, and then they call me and we go in and we do our best to fix it. But that's because the studies that looked at heart disease were predominantly done in men. And when you look at the breakdown of some of the earlier studies, they were done in white men. And a lot of these were VA patients. And so while I think it's important to realize that that's how some people present, it's more important to realize that's not how everyone presents. And so when we see women, for example, that present to the emergency room, they often get treated with less aggressive medical interventions early on because they don't present with classic symptoms. They may say, I just don't feel right. Something is wrong. And if something acute changes, get checked out. And if it's really bad, go to the emergency room. If you're not real for sure, talk with your primary care. But it is vital that you get checked out. Women are much more likely to present to the emergency room with shortness of breath, with nausea or abdominal pain, and actually have heart attacks. So I can tell you from clinical experience, I see this all the time. I had an 80-year young lady that came into the emergency room about 3 weeks ago, and her chief complaint was she'd been having abdominal pain, and she had had that pain for about a month.
Right.
And when she came in, she said the pain kind of had been stuttering off and on. But when she came in this time, she came in because it had been on for about 4 hours and it was just not going away. She'd taken her Tums, she'd taken Mylanta, and symptoms had just not improved. So she came in. Well, when she came in, because the ER staff was adept and they said, well, this is abdominal pain, but could this be heart? They did an EKG. Yeah, she was actively having a heart attack. And all this time had probably had stuttering pain from very, significant blockages that
Right.
then completely shut down, causing the pain that was unrelenting. We were able to go in, we were able to put a stent in and fix that issue. And she's doing great now. But she didn't present with classic chest pain. So be aware of that. You should talk with your primary care about what your risks are. Talk about what are ways, more importantly, to mitigate those risks and to reduce them. So once again, a really long, rambling answer to that question. But yes, healthcare visits are the key to making sure you're on the right road.
No, not at all. Was not rambling. It was right on point. And I share this story with everyone, but my mom was just 54 when she passed away. She was very atypical, didn't present with, the typical chest pain. So I push this out widely with everyone. I mean, just because you look really healthy and look great, and she did, doesn't mean that you are healthy. You really should have those routine health visits. So thank you for sharing that. And then the other question, our next question is about stress. And, um, how does stress really impact the heart? Because some people say, oh, it's stress, it's okay. Does it really impact the heart? What strategies should we, share that can help them manage stress effectively?
So once again, this is do what I say and not what I do, because as professionals, as both an administrator and as a clinician, I have two hats. Stress is always around us. Um, and in situations where you can't avoid stress, you need to come up with ways that you can deal with it. Stress is horrible for your body. Stress is not just in your head. Stress actually causes your body to release hormones stress-induced hormones that wreak havoc on your cardiovascular system. Matter of fact, there's actually a condition called Takotsubo's cardiomyopathy. It has other names. The other name is stress-induced cardiomyopathy, sorry. And then the really cool pseudonym for this condition is called the broken heart syndrome. And so when someone has presented with a sudden shock, really bad news, have been under stress, the surge of these stress hormones, whether they're catecholamines, cortisol, whatever, these stress hormones get released, it actually can impact directly the function of the heart muscle. And it's called Takotsubo, that's Japanese for an octopus trap. It has a very distinctive size. The apex of the heart, the pointy part of the heart, dilates out, blows up, and stops pumping blood. And so the function develops. Now, the good thing about stress-induced cardiomyopathy is that a good percentage of the time, you can identify it, you can treat it appropriately, you can put people on medications, and that function returns. But you really have to find a way to deal with stress. And so, once again, easier said than done, but finding ways that you can go about reducing the stress, letting things, I mean, I look up to a lot of people in my life, and the ones that we look up to are the ones ultimately who have figured out ways to lead very productive lives, but then don't let the small things bother them. They don't sweat the small stuff. They have very good outlooks on life. They have the ability to prioritize what's the most important. What do I need to do first, second, third, fourth, fifth? And doesn't matter that one of our clients is upset. Well, it matters to them, and it does matter. Should it impact your overall well-being? Absolutely not. I'm not saying blow off everything at work. I'm not saying that, Bart, if you're listening. Please listen.
He's always
But
listening.
but I guarantee you, Bart wants you to be there and be productive so that you can take care of yourself. So for the rest of us here at Ingenovis can work with you. But come up with ways that work for you. Some people love meditation, and meditation is absolutely fantastic. Whether you meditate, prayer, whatever it may be, it's a time when you can shield the rest of the world out and you can focus on breathing, focus on nothing. And the benefits of that are just insurmountable. Whether it's yoga and stretching or exercise where you can tune out the background noise of the world and let your mind come back down to this nice equilibrium. It's vitally important.
Right. No, I agree. The ACT program, as you spoke of when we started our webinar today, but it's been amazing to just really, focus on self-care, make sure that others are aware of how important self-care is, and, utilize some of those mindful practices, some of those meditation tools that we provide our clinicians. So they actually work. You should use them. Use the tools that we provide
Funny how
you.
that works, I
Yeah,
know.
it's very helpful. Um, okay, and you spoke about, for our next question, you spoke about, and we'll get to you have a couple questions in waiting too from the listeners today, but you spoke about warning signs of heart attack and cardiovascular emergencies as well. What should someone do when they experience them? And not just, hey, call 911, go to the doctor. We always say that, but then usually you sit there and you question it first, right? If you could talk about that, right?
So, the last thing I want people to do is to overreact. But if I have 10 people that overreact, and one of those is appropriate and we have a life saved because they got an early intervention, I'm willing to accept that. I'm willing to expect it. And so when people come to the emergency room, when we look at how many people come in with chest pain because they're concerned they're having a heart attack, there's a good chance, I'd say 70 to 80% of them have absolutely nothing wrong with their heart. That's perfect. That's great. You came in, you had an issue. Maybe it is acid reflux. There's a lot of things that cause pain in the strike zone, as I like to say. And
Absolutely.
I don't just include the heart as that. From basically eyeballs to belly button, anything in between. A lot of things cause discomfort, concerns, or symptoms in that area. If you don't know what it is, it's best to find out. And if it's something that came on quickly or suddenly, don't wait. Go to the emergency room. Because I've seen so many people that wait until it's too late, and they've had heart attacks, and they skip it, and they say, well, yeah, it's weird, they'll come to the emergency room because they can't breathe. And when you talk to them, say, have you been having chest pain? Well, I don't have it now. I'm like, have you had chest pain? Oh yeah,
Right.
about 10 days ago, I had 3 days of horrible pain. Every time I try to do anything, it would just crush me. But you know what? It went away. And I felt fine until now that I can't breathe. And when you realize what had happened, they'd had a heart attack. And
Right.
they were actually quite fortunate that they lived. They didn't have an abnormal heart rhythm that killed them. They survived, but now the whole front part of their heart has died, turned to scar, and is not pumping. And so because of that, then they developed that last category that I mentioned earlier, congestive heart failure, and now their heart's just not able to pump enough blood. And so they're short of breath. So we have to put them on medications and try to strengthen it. But once part of the heart dies, it doesn't come back. We don't have the ability to regenerate muscle. And so if you're having symptoms, time is muscle. Get to the emergency room as soon as possible. Let them check you out. They'll do EKGs, they'll do some blood tests, ask you some questions. And if they determine that it's not a heart attack, great. Then they can take the next step in figuring out what's causing that. It might be acid reflux. It might be a pulled muscle in your chest. It could be a viral infection that caused spasm of the airways in your lungs. A lot of things that it could be. We want to rule out heart first, and then we can look at other things. Because there are a lot of other conditions that may not be the heart that may be vitally important as well. We commonly see people come in with sudden onset chest pain and inability to breathe, and do an EKG, and it's normal. We don't quit. We don't stop there because there are other conditions like pulmonary embolism, blood clots that travel out to the lungs that can equally cause you harm or kill you. That's not a heart attack. We identify it with simple tests and can treat it and make sure that that doesn't happen again. So it's important. So you're at home and you have symptoms. What are those symptoms? There are 1,000 things that you can do. First thing is to stop, check your pulse, do an assessment. Is this something that happens every other day? Is this something that's new? How severe is it? When in doubt, call 911. Um, Very, very rarely do I ever tell people not to call 911. I have had patients in different situations and environments that say, I didn't want to bother. I didn't want to call 911, so I
Hear
just
that.
move in. I had a patient of mine literally drive himself to the emergency room, um, bypassed other hospitals that he didn't want to go to because we had a good relationship, drove all the way in, was actively having a heart attack, opened the door and passed out and actually had a cardiac arrest
Wow.
in the driveway of the emergency room. Luckily, he was there. They went out, they revived him, got him back. We fixed his heart attack. And I scolded him profusely for not calling 911. Because if you're driving or if someone is driving you, another story, I mean, and I think back, this was about 15, 16 years ago, one of my earlier cases, a young guy, and it was very, very unfortunate. A young guy, it was Thanksgiving. He started having chest pain right after Thanksgiving dinner. He was, early 40s. They got, oh, well, not a big deal. Had his wife drive him to the emergency room. About 3 minutes before he got to the emergency room, he went unconscious. That's weird. I'm right near the ER, so she kept driving. Yeah, he had died, and we were able to get him back. But unfortunately, um, things were horrible. Had he been in an ambulance when that occurred, they would have had the ability to perform CPR and to perform a code and hopefully restore his native circulation so that he could have survived. But once the damage is done, it's done. So call 911. Don't drive yourself. Get care as soon as possible because time is muscle.
Right. No, and you brought up a couple other things too about, different types of symptoms. And we've mentioned atypical. I've had patients mention, oh, it was just a lot of indigestion. Oh, it felt more like gas pain to me,
Mhm.
but it didn't go away. It was unrelenting. Those are also different types of things that I've heard in the past. And it's just surprising that they actually came in and they sought care because they honestly thought it wasn't their heart at all.
Right. I constantly hear people saying, I'm so embarrassed. I can't believe I bothered you or I took up your time. Please never, ever say that. Because like I said, I would far rather have an 80% reassurance rate. That's what I see,
Right.
giving reassurance than saying, wow, I really wish you would have come in because now there's nothing that we can do. Um, it's always something we can do.
Yeah,
Might not be ideal.
exactly. Earlier is better for sure.
Earlier is better.
And then you mentioned already some different types of things different ways that you manage or treat heart attacks or cardiovascular emergencies. So I don't know if there was other that you'd wanted to touch base on.
Yeah, we have in 2024, the resources available to us are absolutely impressive, especially, within the United States. Um, the the gold standard, the way that we should and we treat heart attacks in most facilities is by doing what we call PCI, or percutaneous coronary intervention. That's kind of the term that oversees angioplasty and stents. This is when we can go in, we can perform a procedure, usually through the wrist. Used to be from the groin. We'd get into the vessel, go up to the heart with a catheter, inject dye, and with X-ray, we can actually see the blood vessels. More importantly, we can see the area that's narrowed, the area that's blocked, the area that needs to be fixed. We can then go in with little specialized tools, and we can suck out some of the clot if needed, or we can just go in and put a balloon and expand that balloon, restore blood flow to that area. Utilize stents. A stent is a little metal alloy coil that goes in. It's compressed down over a balloon. We can go and we can expand that up. It acts as a scaffolding that then helps keep that vessel open. It is metal, and your body will eventually grow around it, but it really helps prevent those blood vessels from spasming and shutting right down after you inflate them with a balloon. So it's fantastic. And other facilities that don't have these kind of capabilities, they have to rely on medications. We've had medications called clot busters or thrombolytic medications for many, many, many years. When I was in the military, if you're in a deployed environment, you may not have a cath lab nearby. So we've had to give these medications. They actually target the clotting mechanisms of our body, and they reverse it. And they can go in and they can actually dissolve the clot that's in the heart. They have risks. And the downside of those is that, one, you have to pump the blood to the area where the clot is formed for the medications to work. And if you're having a bad heart attack and you're in circulatory collapse, the blood might not be circulating and pumping well enough. So shock is a contraindication to that. These medications dissolve blood clot, but they can also increase your risk of bleeding. And sometimes, unfortunately, that bleeding can be in the brain. And so if you give the medication to someone who's at high risk for having a hemorrhagic stroke, they can actually have life-threatening bleeding in the brain. So these medications, while they can be life-saving in the right scenario, aren't nearly as good as angioplasties and stents. And so within our division, just kind of as a side note, it used to be that angioplasties were only performed in major medical centers. The procedure has only been around since late 79, 80, and the initial cardiologist who invented the procedure, a guy named Grunzig, who is our idol, invented this balloon and figured out a way to go in and open up blood vessels. But they were only done in major academic centers. And then it started to dissipate out, and they were only done at centers that had cardiothoracic capabilities. And because if you take a balloon and expand it, you can tear a blood vessel. And if you put a stent in, you can tear a blood vessel. And if you don't have a surgeon that's right there and trained and ready to fix that, then the patient may die. We're now good enough, and the equipment is good enough that we no longer need a surgeon on standby, and we can do these procedures in more remote environments. And CardioSolution, now VitalSolution, where I'm the chief medical officer, we primarily focus on rural America because these are the areas that have had such a hard time retaining and recruiting physicians. We go out there and we can provide services to people that otherwise would have been forced to drive or be flown hours to the closest facility to perform these procedures. So
Awesome.
it's incredibly rewarding to work in an environment and with an organization that has such an honorable mission. So it's
Very forward thinking.
very
Yeah.
exciting.
Well, thank you for that. And I don't want to run out of time for your questions. You do have some questions. They've been waiting quite a while. the questions that we didn't get to was more about specific populations or demographics at risk for cardiovascular. And I know, African Americans is one of them. There's other, ethnic backgrounds and different comorbidities that increase risk. So I don't know if you want to touch on those really quickly, and then you do have some questions that are waiting for you.
Perfect. I'll be brief, but yes. So the first and foremost, it's important to realize one, not all people present the same way. Be aware of that. And as a provider, we need to have very open differential diagnosis when someone's coming in. Could it be this? Could it be this? And not have a narrow mind. If you don't have chest pain, it's not a heart attack. Absolutely false. And people nowadays really are in tune to that and aware. Communication is key and knowledge is key. If you have no clue what your medical conditions are, then you don't know what your risk is. Our pre-test probability that you're having a heart attack goes up dramatically if you come in and you're like, I've got a 75-year-old male who's a smoker who has diabetes and high blood pressure. I'm automatically, I'm not excluding, but my differential diagnosis shrinks
Right.
a bit at that. So know your conditions. In people that are non-English speakers, it's important that either you have a good translator or make sure that the hospital itself has translation capabilities, because it's so vital to be able to explain articulately what you're actually experiencing. But we, unfortunately, because sometimes, things get busy and we get hurried, people that are not, that have communication gaps, whether that's, people that are deaf, people that have different foreign languages, communication is huge. And then realize that, and I mentioned this earlier, that different ethnic groups may present differently. A lot of different groups may present more and describe things in terms that don't always click those bells that tell
Very
us.
different. Hmm.
I've had a lot of people that come in and say, I'm feeling dizzy in my chest. Okay.
Okay.
So my initial reaction is, okay, we'll call psychiatry and let's evaluate. No, I'm just kidding. Try to figure out what's going on. No. But when they explain and they kind of, when you delve in, what do you mean you feel dizzy in your chest? Dizzy is when you stand up and you feel like you're going to pass out. They're like, yeah, that's how it feels in my chest. And come to find out that these people were having atrial fibrillation and they felt this funny sensation in their chest, and that's how I described it. So
Right.
different ethnic groups may describe things differently. It makes sense to them. And we need to have very open minds when we are assessing them so that we don't exclude and distract from a rapid, accurate diagnosis.
Perfect. Okay. Thank you so much. And there are a couple questions waiting in the wings here. The first one from Joseph is, I have observed many males over 50 with coronary artery disease or other cardiovascular issues have excess belly fat. Is belly fat linked to heart disease?
So yeah, there's a lot of different physical exam findings that we look for. Some central or visceral adiposity absolutely is a risk factor. Sometimes we look at the creases in the earlobe. Sometimes we'll look for exanthomas, that are little cholesterol deposits from people that have high cholesterol. Absolutely. And when we talk about just the spare belly, we talk about visceral fat. We are more talking about people that have metabolic syndrome, and they have the problems arise about how they have higher levels of insulin and decreased insulin or increasing in insulin resistance. And so yes, those are at an increased risk. So we
Thank you.
should bear in mind that
Need to lose that belly fat, right? Okay.
exactly. Do your fun.
Next one, the next question that we have is from Elvin. And the question is, diabetes runs in my family, and my mother actually passed away from cardiac arrest as a result of advanced diabetes.
Mhm.
If I have children, what is the risk of inheriting these conditions?
So I'm at a loss to give you a percentage. What I can say is that depending on the type of, there's different types of diabetes, in a sense that we categorize them based on, for example, talk about type 1 diabetes, type 1.5 diabetes, and type 2 diabetes. Type 1 diabetes is a problem with your body not making enough insulin. The pancreatic cells that normally form insulin may not exist or may not exist in large enough numbers to produce an adequate amount of insulin for your body. And that actually is something that we see can be genetically related. Type 2 diabetes is very different. That's more where someone has significant insulin resistance, and their body, they make insulin, but it requires so much more insulin to process the sugar in your bloodstream that you start developing a lot of the central adiposity, like we talked about in the last question. That's less likely to be genetically in a genetic condition. So without knowing a little bit more, it's hard to say. But what I can say is that when we see certain conditions run in the family, early and regular appointments with your medical team, more importantly, to identify if you individually have diabetes, and to make sure that your children get screened, make sure that their blood sugars are tested on a regular basis. And it's not just a one-time and done test. It's something that we have to watch for the rest of our lives, because we can develop diabetes at any point.
Thank you. Okay, yeah, I think we'll get to our next one. What are some simple things someone with chronic issues and limited mobility can do to improve heart health? Like if maybe they can't exercise as adequately as they need to lose weight.
So I've seen a lot of people with a lot of very significant abilities, and we have to get creative. One of my favorite therapy forms revolves around water aerobics. I've had a lot of patients that in the military, some of them are amputees, some of them don't have legs, some of them don't have use of all their extremities. There are ways to get those people in the pool. Pool and water work, it's no impact, or very, very, very low impact, but it provides outstanding resistance training. Water walking, there are, floats and devices where you can limit how much you're actually in the water. But there are a lot of techniques. Some people, they can sit down and they may not be able to run, but they may be able to use a recumbent bicycle. They may be able to use a hand crank bicycle. They may be able to do chair calisthenics. Don't overrule, or don't dismiss an exercise because it's not, bench pressing, 200 pounds.
Right.
It's the process of devoting time to strengthening and conditioning. There's a health condition called POTS. It's postural orthostatic tachycardic syndrome, and it essentially is seen in a lot of younger people. And I had a lot of these patients when I was in the military that are young, and they pass out very, very easily. Their heart cavity is a little on the smaller side, and you have to train them over time to do more and more and more exercise gradually so that the heart starts to expand enough to pump enough blood so that they don't pass out. And we start very, very low. Some of these patients, we have to start with just a simple hand crank exercise. And over time, they build up, And I've seen people do very, very well. You're not going to go from 0 to running Boston Marathon in a week. Start off and do what you can do. Don't overdo it. Don't, but and don't get discouraged if you're not seeing the kind of progress that you want. It takes time. So there's a lot of ways out there. But I send a lot of people for water conditioning.
I like that. No, we have a pool my husband uses often. I don't use it, but I should use it more. I really appreciate that. And you do have another comment. It's actually not a question. It says, no question, just a comment. This has been a fascinating discussion. Thank you. And that is from Marie. So thank you, Marie and Joseph, Elvin, Josh, everyone who sent in questions. And we're almost at time. Is there any last advice that you'd like to leave for your listeners?
No, I mean, I really appreciate everyone. I appreciate the time that you've granted to have this discussion, and I appreciate all those that took the time out of their day to log in and to listen, or pulled it up on the webcast or the podcast later on. It's important. Take the time for yourselves to focus on a few simple things to help prevent issues down the road. It's so much easier to treat or to prevent heart disease than it is to treat it. If you do have symptoms, don't blow them off. Don't wait. Seek attention and get evaluation early, and then follow up with your primary primary care team. Know your medical conditions, know your risks, and take an active role in treating those. So thank you.
Well, thank you so much, Dr. Brad Serwer, everyone. This has been a really nice conversation, not just a presentation. So it was very special today and very timely. I appreciate you being here. And we're hoping that you will join us next month for another webinar on ACT for healthcare webinars for professionals. And be well. Thank you.
Thank you all so much.